Advance directives. Definition. Advance directives are legal documents that allow patients to put their healthcare wishes in writing, or to appoint someone they trust to make decisions for them, if they become incapacitated. An advance healthcare directive, also known as personal directive, advance directive, medical directive or advance decision, is a legal document in which a person specifies what actions should be taken for their health if they are no longer able to make decisions for themselves because of illness or incapacity. Need. Advance directives were created in response to the increasing sophistication and prevalence of medical technology. Numerous studies have documented critical deficits in the medical care of the dying. It has been found to be unnecessarily prolonged, painful, expensive, and emotionally burdensome to both patients and their families. Types of advance directives. The living will. This is a legal written document that spells out what the patient does or does not want by way of life-extending medical treatments. A living will applies to the patient in a hospital or nursing facility. It holds no power with emergency responder, ambulance, staff or emergency department staff. The living will is only used at the end of life if a person is terminally ill, can't be cured, or permanently unconscious. The living will describes the type of medical treatment the person would want or not want to receive in these situations. There are many things to think about when writing a living will. These include: if client wants the use of equipment such as dialysis machines, kidney machines, or ventilators, breathing machines, to help keep him alive. Do not resuscitate orders, instructions not to use CPR if breathing or heartbeat stops. If client wants fluid or liquid, usually by for, and or food, tube feeding into his stomach, if he couldn't eat or drink. If client wants treatment for pain, nausea, or other symptoms, even if he can't make other decisions, this may be called comfort care or palliative care. If client wants to donate his organs or other body tissues after death. Healthcare proxy. This is a legal document in which an individual designates another person to make healthcare decisions if he or she is rendered incapable of making their wishes known. The healthcare proxy has, in essence, the same rights to request or refuse treatment that the individual would have if capable of making and communicating decisions. Durable power of attorney. This is the third type of advance directive. Individuals may draft legal documents providing power of attorney to others in the case of incapacitating medical condition. The durable power of attorney allows an individual to make bank transactions, sign social security checks, apply for disability, or simply write checks to pay the utility bill while an individual is medically incapacitated. There are many advance directive formats. Some follow forms outlined in state laws, others are created by lawyers or even the patients themselves. State laws and courts decide whether these documents are valid. Be sure to know specific requirements of writing legal advance directives in state. POLST, physician orders for life-sustaining treatment. A POLST form also helps describe patient wishes for health care, but it is not an advance directive. A POLST form has a set of specific medical orders that a seriously ill person can fill in and ask their healthcare provider to sign. A POLST form has to be signed by a qualified member of healthcare team, such as doctor. Emergency personnel, like paramedics and EMTs, emergency medical technicians, can't use an advance directive, but they can use a POLST form. Without a POLST form, emergency personnel are required to provide every possible treatment to help keep patient alive. The most common topics included in a POLST are as follows: cardiopulmonary resuscitation, CPR, attempt to restart heart; mechanical respirator ventilator, machine that breathes for patient; tube feeding, tube placed in stomach for liquid food; use of antibiotics; requests to stay at home and not to transfer to an emergency room; requests not to be admitted to the hospital; pain management; avoiding needle sticks and other painful procedures. DNR/DNI. It is not necessary to have an advance directive to request a do not resuscitate (DNR) or do not intubate (DNI) order. These are simply doctor's orders that would be placed in the medical record for a patient currently in the hospital or other nursing facility. Nurses' ethical obligations for care. Nurses must be well informed about end-of-life care to ensure that patients understand the decisions they make and their consequences. American Nurses Association Code of Ethics, 2015, defines the ethical obligation of nurses to educate patients and advocate for their legal right to self-determination. The role of the nurse is to advocate for every individual to ensure that the right to self-determination, which includes cultural and spiritual beliefs, is upheld. Nurses must be well informed about end-of-life care to ensure that patients understand the decisions they make and their consequences. To accomplish this, nurses must be knowledgeable about moral and ethical rights and state and federal laws related to end-of-life care. Nurses must be able to answer questions asked by patients and family members and clarify confusing and/or conflicting information. If the patient becomes incapacitated and has appointed a healthcare surrogate to make decisions, nurses must confer and support the healthcare surrogate with decision-making. Nurses have a moral obligation to ensure that the healthcare surrogate makes decisions based on the patient's wishes. If the patient is incapacitated and there is no appointed surrogate, nurses must advocate for decisions representing what is best for the patient and assure that any values are upheld.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.